My mother taught me that the biggest capital that there is in humanity and all the world is human beings. That the very essence of livelihood must always evolve around humanity. She taught me at a very early age that it is important to empathize with humanity than to look for wealth which you don't take beyond life. This is why I founded Joseph Osei Jaba Foundation. It is to be an organization that empathizes with the basic needs of humanity. Talk about healthcare, education, looking after people in prisons. Wherever we go, wherever our train passes, the very essence of our organization should evolve around humanity. This was how I was raised, as I said, by my mother.
This is Fofie. A suburb of Asokore in the New Juabi municipality of the eastern region of Ghana. With over 1,000 residents who are mostly farmers, Fofie's major challenge is the lack of a decent healthcare facility. This ill-equipped, dilapidated wooden structure, donated by the assembly member of the Fofie electoral area, Isaac Osei, serves as the only healthcare facility for hundreds of residents.
The Honorable Isaac Osei, assemblyman, I move Fofie electoral area. Now, baby, I'm a baby, a nurse for a being called in Crawford's Babaji Ayalasa, a Wahano. Na mfikianse na omo bae no de ma mi hu yen se no motete nkrofo dan enchim omo ye adwuma ke so ye me yere de oye mu adwuma te ma me ne me yere kasa se de bia mfama nurse fo no na omo ntem na ma mfo meje omo ayalesa e wa hanom na omo wi nkrofo so e wa hanom nti ampa me ne me yere ka ma ntia se ye adwuma na me de ma omo so omo ntra ham enye adwuma na me omo gu so tan omo ye adwuma omo ja ayalesa no se se de nkrofo e ba no tena se me ne me yere ka ne de hanom permanent omo tra hanom eye adwuma tem bia se de amanfo be hu sampa nurse fo no won ma do pa wi ani adwumre a omo ye adwuma wa hanom ti ampa me ne me yere ka man ti se ye adwuma ma ba bia in fact me yere ye adwuma me stop o ma be da ma nurse fo na se sei omo tim for permanent a omo ye adwuma eje ayalesa ne omo be wi nkwala e wo hanom.
A midwife here laments the situation is a major headache both for healthcare workers and residents.
My name is Mrs. Diana Jima Prempe, a midwife at Asokore RCH. We are at Fofie, a suburb of Asokore. Since we came here, we provide child welfare services, family planning to the mothers, and then minor ailments to both children and adults. Our challenge is, even if it's rain heavily, the mothers could not come to the facility. A mother fell in the gutter because even there is no flood on the gutter. It's a challenge. Then when it rains heavily, it's also enter into the kiosk. And when the sun is too hot too, they were not able to sit inside. They have to sit outside. We also provide antenatal, but because the place is not conducive, we don't come here. So the mothers will still come to the health center for the antenatal services.
Apart from challenges of child welfare clinics and the lack of privacy for patients who come here for family planning services, this nurse says storage for drugs and patient record is a big challenge.
My name is Doris Agbejinu, a community health nurse posted to Asokore Health Center. But this is our chip zone, Fofie Chps zone. This is where I work. We know that in providing family planning services for our clients, we have to ensure privacy. We have to make sure that they are comfortable. But looking at the structure and then looking at the situation here, there is nowhere the clients will feel much comfortable in providing the privacy for them. So mostly what we do is whenever they come for family planning services, we have to provide privacy by releasing this curtain here and then ask them to sit in the corner so that other people passing by will not see what is going on here. So that is what we do for those who come for family planning services in the chip zone. So this is our weighing scale. And as you can see, it is nicely hanged on this structure. This is where we have our weighing. We weigh the we hang the children here to take their weight. So this is where we mostly check the weight of the children. This is where we hang them. We also provide treatment for minor ailments. And this is where we keep our drugs. Anytime they come for treatment, this is where we keep our drugs. And then this is where we keep our folders. Those who come for treatment, their folders, this is where we keep them. And then we keep the drugs here. And because the place is not so much comfortable being here, anytime it rains, you come back and then you meet all these things being soaked, especially where we keep the medicines and then the folders.
Some nursing mothers say in spite of its stage, the facility continues to serve their healthcare needs.
My name is Mavis. I'm a mother of 2. And I brought my child for weighing. At first, where we were staying and where the clinic was very far. But now we have this one close to us and we are very happy. So that in case of anything, we normally come here. There are some challenges that we are facing, especially when it rains. It normally comes here. And when the sun too is very hot, we can't stay inside. And once that we came here, it rained very heavily that we were even afraid to stay inside. And we were thinking that the wind would carry the store away.
And then the millicent said, "Me baba we na baby I wanted the ben pa and so ye ba and near my be high wa ha. Ye de mama ha na su otu aye bre bi wa kra so ni to meet you fast store nim na ye man ye say ye gire ho enti ye hiamwa say mo beba beboa ye aban no na mo abonten me kra emre bi me ba say me yare na nka ye say nka mo gi me to kakra Manya baby and no mama me no mama sa na te koye. Me de baba we. And so in fifreti e pa, mo he story mu a. Nke boa ye wo ha no and so ye bre wa ha kakra.
Touched by the plight of the resident, Joseph Osei Jaba, a philanthropist through his JOD Foundation, commenced the construction of this facility for the community.
I once visited this constituency. That's a New Jobbing North constituency in the eastern region of Ghana to meet up with a friend and catch up with old times. He happens to be a schoolmate from the University of Ghana where I attended my university education. And it was at this point that we stand that I saw a woman in labor being rushed to a kiosk, a box, I don't even know how to describe it, which is or was supposed to be the first health facility to provide assistance to people in labor and for weighing and all other things concerned with health in the community. Honestly, when I saw this, I was moved beyond words as to how healthcare could be brought to such a structure. I quickly had a conversation with my friend and asked how and what we could do to help. It was in the conversation that I was made to know also that the nearest health outpost in the whole of the city, Koforidua, was at the central hospital from where we were on the day of this event. And looking at the distance between where we were and that place, it would take averagely the woman in labor a good 25 to 30 minutes to reach the central hospital. And this woman was in pain. She was crying beyond what I'd ever seen in my life. And I resorted to funding and doing something at the very point we stand today to help the community and everybody that finds themselves in that situation. Later on, I got to realize that it wasn't just for pregnant women and women in labor. It was also the first point of contact when there was an injury in the house or was an emergency burn or something. That's where they brought the patients to be looked at, temperatures to be taken before they took them to the main hospital. This is why we picked it upon ourselves as an organization to build a health post here for the community and give it to the government to use as a place that people can come to find standardized health care and to be able to be looked after before, if it's necessary, being taken to the general hospital. Thank you.
So this is the facility that's been built to take care of the harsh conditions that are pregnant mothers and mothers go through, right? This facility houses 4 different departments or sections of the various phases that one would have to go through when he or she attends the CHIP compound for medical care. This is the waiting area, as you can see. This is the waiting area where we're going to have almost everybody who comes here to access service, having to wait patiently for attention by the health workers here. So this very room is supposed to take care of antenatal issues, where we're going to have the midwife attending to pregnant women. From here we get to the store where we're going to keep the equipment and the various instruments that will be used to take care of sick patients. You come here, this is supposed to be where they're going to detain people or sick people for probably a day or 2 before they are referred to bigger clinics and hospitals around. And then you come in here, this is supposed to be the facility for the nurses. The nurses are going to be staff of this very CHIP compound. In there we have washroom, right, to really take care of their pressing needs. When you come here too, there's another area for, it's a toilet facility for patients to be coming. In fact, there are 2 toilet facilities, one for male and one for female. So basically, this is the what we've been able to do. We're hoping that in the course of time, if we're able to get a bigger land, we should be able to do something worth the while than what we've done so far. So that's about it. Thank you very much.
Regrettably, the much-needed project is yet to be put to use due to lack of funds to complete it. As such, residents, nurses, and the assembly member are appealing to benevolent organizations, corporate institutions, and individuals for support to get this new facility running.
We are appealing to any individuals, NGOs, or the government to come to our aid so that we'll get a better place to work at.
Man for Eba Between Honorable Isaac, baby at the man as a form yegme. In fact, Nelson, a near kitty baby, one, Senka, Yenya, a man for a man baby boying. Am I young to me and maintain keys we no more time we are Duma in Cabeb boying. The baby a do here a man for donation. Some baby boy. Need PTC KC, and there's if for some Ayaduma Ayalasa, Ashawum, and then waiting for at my mom wing now will be a young motor, a wahano.
We are appealing to individuals, NGOs, the governments, anyone willing to come to our aid. We are appealing that they should come and assist us by putting up something more comfortable for us, because this place is so much uncomfortable.
Ebre wa hakakra tie pamocho momwaye ihia moa sem besikere ne kini bia maye ihia abontin so for aban panifo bibiara obeboaye momeboaye ihia moa se de obesi bia maye yes level.
This is where we are and it's helping us a lot, but it's not in a good shape. So we are pleading to anyone out there who can help us to build a new one for us.